A lot of times people who are coming to see their medical provider, they're having a bad day, right? I used to do that at Catholic Social Services too, and folks who are coming there, that's their worst day. They're having their worst day when they come to see you. So I just want to be there for people when they're having the worst day. I love working at Anchorage Neighborhood Health Center because we can give people the highest quality, the best health care with the best team, even though they might not have anything else in the world.
Welcome to the East Anchorage Book Club. I'm your host, Andrew Gray. The purpose of this podcast is to tell the stories of Alaskans of interest and importance. Today, our guest is the Executive Director of Anchorage Neighborhood Health Center, Lisa Aquino. Before taking over ANHC, Lisa was the Executive Director of Catholic Social Services. She has a Master's of Health Science degree from Johns Hopkins School of Public Health. Anchorage Neighborhood Health Center is a federally qualified health center that provides primary health care services to everyone in our community, with a special focus on those who face extra barriers to care. Anchorage Neighborhood Health Center is accepting new patients for primary care services and has behavioral health services available to all its established patients. To establish care, visit anhc.org or call 907-743-7200. Lisa Aquino, welcome to the podcast.
Thank you. I'm so happy to be here.
Tell us a little bit about your childhood.
Sure. I grew up here in Anchorage. I went to Susitna Optional Elementary and I went to Bartlett High School. I'm a proud East Sider. My dad is, now he's retired, but a longtime emergency room physician here in town. So grew up here and loved growing up in Anchorage. I'll say that like so many Alaska kids, I was like itching to leave. And I did leave for university, and I'll tell you that it feels like as soon as I left, I was like, man, I wanted to come back.
Where did you go to college?
I went to college at UCLA. I got my Bachelor's of Science in Anthropology. I was probably going to be headed to a different school, but I decided to take a year off after high school, and my family and we took a sabbatical together and traveled. We went on an overland trip in southern Africa, and we lived in Costa Rica, and that just changed my whole world. After that, I really wanted to go to a big place and be around a lot of different kinds of people.
And there's 3 kids in your family?
I have 2 brothers and a sister.
Oh, so there's 4 kids in the family. Mm-hmm. Yeah. Which number are you?
Oldest.
The oldest. You got your bachelor's in anthropology.
Yes.
Did you want to be an anthropologist?
No, I loved anthropology, but I really thought I was going to go into medicine. And so I thought this is a great way to still get to study people, which is what I really love, and take all the classes that I'm going to do to go into medicine. And then I decided first I'm going to go and study public health because actually that's what I really love. So I went to Johns Hopkins and got my Master's of Health Science there in the public health school.
Right after?
Right after. Mm-hmm. And I loved it. But I was like, okay, so now it's time to go to medical school. And I moved back up to Alaska and worked and applied to get into medical school. And when I got in, and it was great, and I was so excited. And then I started medical school and I got sick not that long afterwards, and I needed to take a break. And what I realized was that actually what I love is public health. And I'm not sure if I want to go back to medical school and be a doctor. What I really want to do is start working in public health.
Bouncing back, when you decided to go get your master's in public health, the ultimate plan was to go to medical school.
Oh, was.
So were you getting the master's in public health as just a way of sort of like boosting your resume?
You know, I was just talking to my dad about this. I think that I always really wanted to work in public health. I just felt like so many of the people that I knew that worked in public health were medical doctors, and that was what you had to do.
So you felt like you were going to have to go to medical school to get to public health, but you eventually learned that you didn't
have to. No. Yeah. That was my journey. And yeah, I think that this was the path for me. But it's interesting now, isn't it, how you like follow these paths in your life? Because I worked in public health for a while, like direct public health. And now I feel like my journey is using public health in other fields, using that style and way of thinking and approach and bridging that. And so I got a job working at the state. My first job in public health was as a data and evaluation lead for our diabetes program. Shout out to chronic disease prevention and health promotion. And then I got a job leading the arthritis program and then working in the tobacco prevention program. I led that program. Then I got married and we went and lived in South Africa.
Wow. How long were you in South Africa?
About 3 years. So my former husband, he's also from here. Chris, he was in the Peace Corps in South Africa, the first Peace Corps group after they became a democracy. And he loved it and he always wanted to go back. So we decided after we got married, we would go back. And we lived there for 3 years. And I worked for the Desmond Tutu HIV Foundation there. It's a foundation, but it's partnered with a research institute at the University of Cape Town. So they still do a lot of really cutting edge research on HIV and tuberculosis. And I had a job overseeing their youth programming. Yeah, it was really special. I loved it. And my son was born there.
In South Africa. Mm-hmm. Does he have a South African passport?
Uh-huh.
That's awesome.
Yeah, he does. Isn't that cool?
Yeah.
It's a cool thing.
So have y'all gone back to visit?
We haven't. We left, unfortunately, Chris got in a very terrible scooter crash there. So he had a very severe traumatic brain injury. We needed to leave. Like, he was in the hospital there for a while. And then once he got to the place where he could leave the hospital and be on his own, I think it was very clear that he was going to need a lot of help for a while. And it felt like we should probably come home. We came home. And I had a 1.5-year-old. And I was pregnant, 6 months pregnant. And I had a partner who needed a lot of care. And I came back to the States and we lived at my parents' house and I didn't have health insurance and I didn't have, because everything was built in South Africa, right? And it was really scary.
How did you get health insurance before the baby was born?
I got on Denali Kid Care. I applied for all the benefits that I could. I took advantage of the support that Providence gives to forgive debt for folks. That helped a lot with Chris because Chris needed a lot of care. It was tough. It was really tough. And it was really only possible because I have such an amazing network of people in my life, right? Like, I'm surrounded by family and friends who helped me so much, right? All my friends came and brought baby clothes and brought all the stuff because it was hard to bring everything back. And it was a really challenging time. And so I think in some ways, that's why when I eventually went to work at Catholic Social Services, it felt like such a calling. It felt so meaningful to me because for me, I feel like I am the product of so much love and support from people in the community. And gosh, everybody deserves that. Everybody deserves to have that. And it's not fair that some people don't have that. So I hope that places like Catholic Social Services and the Anchorage Neighborhood Health Center can provide that. And that's the kind of community I want Anchorage to be for people.
You were on Denali Kid Care. You had your second child. And where'd you go to work or what?
I also, because I have amazing friends at the state of Alaska that I knew and loved, there was a position that was open. And I applied for it when I was 8 months pregnant. I said, hey, I'm interested in this. I could do this. But can you wait for two months so that I can have my baby and also then be home for a minute? And then when I came back to work, I was able to come in at a little bit. I wasn't 40 hours. I forget. It was like 30 or 32. And it was great. So I went back to work and led a project at the state of Alaska called Healthy Alaskans 2020. Which was incredible. I loved that job. It felt like the culmination of so much work because it's all this public health thinking, but the whole idea is to set health goals for our state. And so we needed to reach out to people across the state to try to figure out what are the goals that we want to reach as a state? Where do we want to go? And that was the first year, and this was the first time this was done in the country, where we set our Healthy Alaskans goals in partnership with the state of Alaska and the Alaska Native Tribal Health Consortium. That hadn't been done anywhere before. And I had an amazing partner in Beverly Woolley who was working over at ANHC. And it was such incredible and important work. And I got to really see and understand a whole spectrum of issues in a different way. So,
well, what did the project do?
What we needed to do was prioritize what were the health issues that we as a state wanted to tackle in the decade by 2020.
So what you wanted to have done by 2020.
But it was funny because we were doing it in the middle of that decade. But that's all right. That's okay. By 2020, this is what we wanted to do. And so we went through a whole process working with partners and people from around the state to try to figure out what the goals would be. And as you can imagine, it was very hard. And in previous iterations of this, because every decade this is something that happens, and there's this national project where they do Healthy People 2020 or Healthy People 2030 now. And in previous iterations, there had been hundreds of goals. And of course, the challenge with that is it's difficult to reach any one when you have so many. They're all important. It's very difficult to say this is more important than that.
Are the goals like less smoking, less drinking? Like
there are a whole range of things. Yes, they have to be measurable. So it would be like a goal around reducing deaths from cancer.
Got it.
Something like that, from X to Y, and having a goal. That's how we approached it. You can approach it any way you wanted. That's how we approached it. We set about to create 25 of those goals, and not
25 seems like a really large number too.
It is. It was. But we realized our learning was that was probably too many as well. And I think in the next decade's project, and I was a part of that for a little bit, I think they tried to have even fewer because you're not going to reach them if there's too many. It's just too hard to do all of that work. And
Did y'all achieve any of the goals?
We did. We did achieve.
What were some goals you achieved?
We had reductions in tobacco use. I think we had some increases in exercise. I can't remember.
How do you measure that?
Exercise. It's like self-report in YRBS, so in youth risk behavioral surveys. So we knew that needed to be a priority. And part of choosing it, and like I said, we chose it as a group. There's a question of feasibility, but it's also a question, like if you knew someone was going to be working on it, like we knew that there's a couple big school districts in the state that were going to be working on it, let's choose that as a goal and let's celebrate their success, right? If you knew that there's a number of school districts that are going to be focusing on physical activity and healthy eating, and if we could raise that up with this effort and then, do a big shout out, and, maybe that's a reason that we should put that in the top 25 because there's people working on it and we want to give them the kudos they deserve.
That's interesting. So my son at his school, he has an activity journal or something they send home. Is that from you guys? Is that why we do it?
I wouldn't say it was from us. I would say that those goals were based on talking to the school district, Anchorage School District, and other school districts who were a part of this work. And they said, this is something we're going to do. And then we're like, oh, as a group, maybe that means that should get raised up into one of the goals. So it's really them doing the work. And we as a group together, including them, calling out and saying that we want to make this one of our state goals, and we want the governor and the head of the Tribal Health Consortium to call this out and say we reached this.
Do you know, did kids in previous generations just get more exercise than kids today?
I think so. It was just a different time, and I think more people walked more places. I think communities were built in different ways, and it was much more common to walk. And so I think in that way, yes, kids got more exercise. I think that
people got more exercise.
People in general, totally. And I think that I don't know if, and I don't know the research on this as well as some of my colleagues, but I think that there's a lot more organized opportunities to participate in different kinds of physical activities now for some kids. But I think, as we all know, those opportunities are not equal across the spectrum.
Right. No, that's really interesting. I know the stereotype you hear all the time is that the average New Yorker walks 5 miles a day, walking to the subway, walking home. And we obviously don't have that in Anchorage.
No, we don't. And that's a part of, that was a part of the conversation, I feel like, when I was in Healthy Alaskans. It was walkable communities, and is there a way to support our communities being more walkable? And it doesn't feel like I don't hear that as much as I did then. But what I'm excited about that reminds me of is that I think that right now, and this feels very true to me because I work in healthcare, it feels like we're just coming out of this COVID time. And in some ways, I feel like we're almost at I don't want to say it like it's a zero with judgment, but we're at a place where we can completely rebuild and create what our future is going to be, because everything ahead of us is going to be very different. And that's how it feels in healthcare to me. I'd be curious if you feel like that. But so with that, I'm really excited and interested to think about approaching conversations with our municipal government partners or with our state partners about what is the kind of community and state that we want to build in terms of thinking about walkable communities. There's this really great framework that I'm very into right now called the Vital Conditions Framework. Do you know that framework? It sits under the Ripple Foundation now, but it was created during COVID by the CDC, actually. And it's using the same kind of model as like the social determinants of health. But it's broader than that, because it's not just about health, right? At the center of it is a thriving and engaged person, right? And what do we need around that person? One of the pieces is health, for sure, and like safety and justice, and we need a transportation or a walkable community or an easy way to get around. We need these things. And then there's like barriers that we need to address. And so I'm really curious and interested to have a conversation with people and say, okay, what's the Alaska version of that? How can we create that? Because I feel like 10 years ago, that was in the air more. But I think that because of everything that's happened in that since then, especially with COVID, we have an opportunity now to have that conversation in a fresh way, because we're past a really hard time. And what can we make of this future here in Alaska?
So you did that job.
Sorry. Yes. I did Healthy Alaskans 2020. And one of the indicators that we had in that was looking at poverty. And everybody thought we got to have that indicator on the top 25. But I was tasked with going out and finding the group that is working on changing poverty in the state. And there's like nobody whose job it is or who's focused on changing that.
It comes up in the legislature a lot.
Really? On getting people out of poverty?
What I would say is poverty has come up. On the Judiciary Committee,
yeah,
we learned what the number one risk factor is for sex trafficking.
Okay.
And it's poverty.
Yes. But then do you ever find out like who's working, what organizations changing?
100%. And the thing is, we were dealing with these bills that dealt with like increasing penalties and increasing consequences.
Yep.
But it seems like if the top risk factor is poverty, then maybe we should spend all of our time trying to eliminate poverty. And I'm not exaggerating to say that people who said this was their focus would be like, no, that's not it.
No, this is
that's
the
it.
one. There's one that ties to all of these things. I know. Me and you had the same insight.
And I bet it's the same thing with diet.
It's the same with everything. It underlies so many things. And I was like, but there's nobody working on it. Every indicator is supposed to go out and find who's the group working on it. Nobody's working on poverty per se. But it's in having those conversations that it came to my attention that Catholic Social Services was looking for a leader. And I felt that's how it felt. It felt like a calling, like kismet. It felt like, okay, this is something maybe this is what I should do, because they're not working on poverty directly, but that's like as close as I could come to figuring out. And I was like, okay, I need to try this for a second. I need to go in there thinking about it like public health, thinking if we can impact the population who are literally falling through the cracks, and so often the reason they're falling through the cracks is poverty, then maybe we could learn something. And I loved it. And it is so
When did you take
hard.
over?
I took over in 2014. And I was there for 7 years. And that organization is incredible. And they do so many things, right? So Catholic Social Services runs shelters, and we were
Brother Francis Shelter.
Brother Francis and Clare House.
Mm-hmm.
We ran both of those, and then now they run more. They also ran the largest, and they still do, the food pantry in the city. They do refugee resettlement. And when I was there was an adoption agency. And they do family disability services. So they are supporting families who have a young person who's experiencing developmental disabilities. And then additionally, they did housing case management. So in addition to shelter,
they were helping people get housed.
Yeah, the most people in the city. See, Catholic Social Services is housing the most people in the city, at least when I was there. I bet they still are. So it was this mega organization doing all these different kinds of things.
All from donations? Grants?
No, grants and donations. Probably, can't remember, like maybe half grants and maybe a third donations. So, yeah, it was mostly grants and donations. So what was great about that was it felt very much like it is an organization of this community. That organization exists because people in Anchorage care about others, and they see this as a way that they can give back and help people that are falling through the cracks. And that's how it felt. I still go into the grocery store and connect with people that I met who were donors at Catholic Social Services, and they're incredible. They're amazing. And they've been giving for 50 years because they really believe in what they're doing and they want to help their neighbors. It's awesome.
Are you Catholic?
I was raised Catholic.
And was that like a prereq?
No, it isn't a prereq. It helped in some ways. It helped to be Catholic. Yeah, and so I could talk to the Catholic community, and I felt comfortable there. But I will say, I'm not a great Catholic. I don't feel like I'm the best representative of that. I got to meet so many people who are really amazing Catholics and can talk from their heart and really explain everything about being a Catholic. And I am just maybe a mediocre one and try my best. But I have deep respect for people of faith. Yeah.
You're currently the executive director of Anchorage Neighborhood Health.
I am.
I did read your statement that was published in Catholic Social Services website about why you were leaving to go to Anchorage Neighborhood Health. I guess, can you talk about that?
Yeah, sure. I got to a place where I think it was a good time for me to leave Catholic Social Services. Honestly, it's the kind of work that you need to be so present and you need to be out there in the community speaking for this. At least I felt like I needed to be in that role. Maybe not every leader does. You can't sustain that forever, right? I got to this time where maybe it's time for me to just look in other places. My kids are teenagers now and I need to be home a little bit more. And then it felt again like just fate, and that Anchorage Neighborhood Health Center, an organization that I had respected and followed for so long, was looking for a new leader. And that felt a great place to bring my skill set in terms of public health and healthcare to a place that is such a important local place for our community, including some of the folks who I worked with in Catholic Social Services who are our clients, but also the whole community. And so I've loved working at Anchorage Neighborhood Health Center, and it feels like I think we're really filling an important place in the city.
For somebody who has never heard of Anchorage Neighborhood Health, how would you describe that organization to them?
So Anchorage Neighborhood Health Center is a community health center. And so what that means is that we follow a model that the federal government designed long ago with the intent of making sure that every person in the community has access to basic health care. And we're a place where anybody can come and get primary health care. And it's all in one place. So when you walk through our doors, you can have your appointment with your healthcare provider. You also will have access to behavioral health. You'll be able to go get lab and x-ray right there on site. We have a pharmacy. We have a dental clinic. We have all of that right there in the building for all of our patients to use. And then in addition, we're working really hard to try to remove barriers to care. The three main barriers we think about are cost and language access and transportation. We have a staff of people who will work with you to try to help you to get on insurance, whether that's the marketplace or Medicaid or Medicare. But we also have a sliding fee if you are not insured. We translate into so many different languages, and we have people who work with us who speak multiple languages. And then we try to support all of our patients working through the transportation system so they can get to us for care.
How long has ANHC been around?
Oh, yes. It's our 50th anniversary this year. We are 50 years old, which in Anchorage is pretty gosh darn old.
That is old.
Yep.
Happy 50th birthday.
Thank you. Yes, Anchorage.
Like this year, like in 2024.
2024. We first started in November of 1974. And it started by a small group of very big-hearted primary care providers. So really started as a place for just making sure everybody had access to primary care. And it's done nothing but grow since then. So some of our longtime providers, some people still work there, right? They worked here there a very long time, and they make such a huge difference. So yeah, happy birthday, ANHC.
Do you currently have availability for primary care if somebody was looking for primary care?
We do. I think right now, if you're a new patient and you're trying to make an appointment for the first time, I think we're scheduling maybe 2.5, 3 weeks out, which in this town is pretty short. In addition, if you already are a patient, we can usually get you in on the same day or within a day or two. But one of the things I'm hoping that we can be educating our community on in the coming weeks and months is how to use Anchorage Neighborhood Health Center and how to use primary care versus urgent care, which you know so much about, versus the emergency room, because I think it's really confusing.
I worked at the VA for 5 years,
Yes.
and we actually, when we were at capacity, we had folks who got their primary care at Anchorage Neighborhood Health.
Mm-hmm.
So we had veterans who were assigned primary care at Anchorage Neighborhood Health.
Yeah.
I'm just going to express something that's just like
Please.
what veterans would say to me. There were some who felt like because you are a clinic that accepts everybody, that they were somehow getting suboptimal care, that it was less than because they're like, I got sent to, the public clinic.
Yes.
So I'm curious, is it really just for people who don't have insurance or who are on Medicaid, or could somebody who had quote unquote good insurance decide to?
Yeah, no, anybody. Yeah, no, thank you for the question. Anybody can come to Anchorage Neighborhood Health Center. Come if you're insured, come if you're not insured. I would say and I know it's hard to believe that I'm not biased in this, but I believe we have the best primary care providers in town working at Anchorage Neighborhood Health Center. We see a wide variety of things, so they're very accustomed to seeing complex issues as well as more straightforward. We do the full lifespan at Anchorage Neighborhood Health Center. So we have providers who are delivering babies, and we see kids, and we see folks all the way till end of life. So this is a place where you can come and you can stay with us your whole life, and you can have the same place that you always come for your healthcare. And we try to make it a place that's very welcoming, but also we have the best technology. We try to really stay on the cutting edge as much as we can, because everybody deserves the best healthcare, whether you have the best insurance or you have no insurance.
I'm really grateful to hear that. And I'll say I do work at urgent care. Mm-hmm. I do print out new patient packets for folks.
Thank you.
However, I think even amongst providers in the community, some of them are not aware that you guys are accepting new patients, that you're available, because what you hear so frequently is folks saying the urgent care has to be primary care because there's no primary care accepting new patients.
Yes.
So I guess I'm saying, for the record, Anchorage Neighborhood Health is accepting new patients, whoever's listening to this.
We are accepting new patients. I should scream it from the rooftops. People don't know that. And we need to do a better job of getting the word out there, because you can get in as a new patient with us. And you can get in if you are, whatever your insurance status. And I want to specifically call out, if you have Medicare, you can get in with us, because I know that's not easy to find a place that will accept your Medicare.
Yeah, the stereotype is that if you have Medicare and you don't currently have a primary care, then you should be going to urgent care, which I just want to say is not true.
Yeah, that is right. That is not true. I feel like we have patients who are our Anchorage Neighborhood Health Center patients who still will use urgent care for things that I think that counts as your health care. That's a part of being a Medicare patient. You can come here. And
I've had folks come in before and say that they were patients of Anchorage Neighborhood Health. And it's been during the daytime. And we've called Anchorage Neighborhood Health and gotten on the phone with the primary care who's, I don't know why she's there. Yeah.
I feel like, but don't you think, because you know this so well, like, I feel like it's confusing. And there's so many people who don't know. Like, they don't know, like, they think if it's not a part of my annual visit, then I should go to urgent care, which is not the case. If you have a provider who's your provider, you should go see them for most everything. There are things that are emergencies and you should use an emergency department. And urgent care is really great for after hours or different times weekends, when things aren't open.
But I think, what are your hours? You have some late night hours.
We do. We have late night hours. So we have night clinic that goes up until 9 on Mondays, Tuesdays, Wednesdays. And then next month it'll be Thursdays as well.
Wow.
Yeah. So we have evening clinic, and that includes our lab and x-ray and pharmacy. So if you're our patient, you can get all of those services at our place when you come.
When I worked at the VA, most veterans do not qualify for dental services. Yes. You have to be 100% service connected as a veteran to get dental services.
Yes.
And dental is very expensive.
It is.
It's also really hard to know if you're getting good dental. You just...
Yes.
And so I think the fact that you do a sliding scale dental.
Yes.
And we have folks who have serious dental needs who haven't seen a dentist in 20 years because they didn't think they could afford it.
Yeah.
Who need to see the dentist really badly. Yes. That is the healthcare they need.
It is. It is. Yeah, we have a wonderful dental clinic. And it is such an important part of healthcare, and it's not covered in the same way. So in a lot of ways, it's underserved for different people, even people that have insurance. In other ways, they might not have dental insurance. I think to your point earlier, it's hard to know, especially if you don't go regularly, it's hard to know, is this good? Do I have it? Not that there's great dentists in town. It's just hard to know if you have a list of things. Is this a top priority?
I'll tell an example from another city so that I don't get anyone in trouble. But when I was living in DC, I got a coupon in the mail that said free cleaning.
Uh-huh.
And so I was like, who's not going to take advantage of that? If you don't have a dentist, you're like, that's right. But I went in and they said, we're going to ask that we do some x-rays.
Yeah.
And then they said that I had 6 cavities that needed to be filled, which seemed like a lot.
Yes.
And do we want to schedule that? And I did notice that when I was checking out that lots of people were scheduling cavity appointments. And so I went to another dentist and they said, let's request the x-rays. And when the x-rays came over, they were overexposed and they couldn't see the teeth. And basically, it was a scam. Like they were getting people in with a free cleaning, but then they were making bank by, I guess, filling cavities that weren't there.
Oh my gosh. Isn't that crazy?
Crazy. But how would you know if you were like, you trust the doctor, you trust the dentist.
You do. You trust the dentist. Yeah, that's a terrible experience. I don't think that there's dentists in town in Anchorage doing that, but I think I think it just demonstrates that with so many things, and I listened to another episode of your podcast, this idea of healthcare as a business, and if it's a business, but this is my health, and I want to make a prioritized list of what's most important from my health perspective, but the business is saying, here's a prioritized list from the business perspective. Those aren't the same things. And it's hard. And that's true in dentistry and true in lots of other.
And I think that's a joke that people make, that they'll say, the goal in American medicine wouldn't be to cure something, because if you cure it, then you're done.
Yeah.
But it would really be more like lifelong chronic treatment is the goal, because then you can charge for it forever. And people laugh and say, oh, that can't be real. But the more I delve into this subject, the more I think that there are a lot of motivating factors to prescribe expensive medications and treatments because that is how you keep your business afloat, because it does become a business.
Yeah.
And giving somebody a one-time shot or a one-time dose of something doesn't keep the business afloat.
No, it doesn't. Yeah. It's too bad. Not to be too esoteric about it, but that's why the things like that model about vital conditions and thinking about health in the largest, biggest sense, like it's not about health care. It's about health, right? And for so many people, they do need to go back to see their provider on a regular basis because they're sick or they have a chronic issue that it takes a while to fix. Doesn't necessarily mean that they're getting price gouged, but can we also put in place some big systemic pieces that is going to make it easier for everybody to be healthy? I think so. I think we should be able to do both.
And to get back to the work that you did for the state, if everyone were eating lots of fresh fruits and vegetables and exercising every day, so many of these chronic conditions,
it would be a
different
exist. And to go back to what we were talking about with poverty, if it was easier to make a living wage and you didn't have to work 2 jobs to survive or to raise your family, then you're going to have the time that you might need to cook a healthy meal or to take that walk after dinner. I just know so many people who are working so hard and that just feels impossible.
That's a really good point, because I think people often think that it's about having the money to afford fresh fruits and vegetables. But really, if you're exhausted, the last thing you want to do is start from scratch. You're going to do a drive-through. You're going to order a pizza. You're going to do whatever, and then you can just relax, zone out.
That's not being lazy. People are so tired and tapped out. I think that we saw sides of each other that in our communities and in the places where we worked during COVID, we saw some things because everyone got more tapped out. But the reality is there's a lot of people out there that are working so hard. And the idea that you could just have the extra time and bandwidth to also make something from scratch instead of just going through the drive-through, besides the fact that it costs less, but also I can't do that and help my kid with their homework. I can't do both. So should I help them or should I go and make that homemade meal from scratch? I don't know. There's only so much time.
This may be a tangent, but when I think about my grandmothers, they never went to an exercise class or exercised, but I do remember my maternal grandmother didn't have a washing machine when I was a small child.
Wow.
So if you were washing clothes by hand, you were burning a lot of calories.
Yeah.
She swept the house. My grandfather mowed the lawn with a push mower. There were just so many things that people did that was exercise, but they weren't quote unquote working out. They were just doing the work.
Yes.
And so they ended up being fairly fit just by the nature of their life.
That's right.
They weren't happy about it.
No.
But but the side effect was that they were healthy.
Yeah.
And I just think now a lot of we're exhausted after a day of sitting at a desk
there's so many conveniences that make life so much easier, right? And I love the conveniences. I'm sure you love the conveniences. And we're exhausted for different reasons. And those reasons aren't because we physically exerted ourselves. It's so much about mental exertion and stress. I just had a doctor's appointment and she was like, if you have all this stress, that you have all this cortisol, and then that cortisol just sits in your body because you didn't go run away from the bear and use it up. And we all have that right now. We've always had it. But these are challenging times. These are really challenging times. So we have to figure out how we are going to go use all that cortisol at the end of the day. And we have to make that be a real thing that we do so that we don't carry this stress around, because that stress, that's what's going to kill us. I feel like I've gotten on a tangent, Andrew, but that's something that I'm really thinking about and focusing on for myself right now and for the people that I work with, because they carry so much. You as providers, you carry so much.
And we as candidates.
Oh, I bet.
This month before an election, it's a lot of cortisol.
I bet it
is a lot of, it's just analogous to people in so many different walks of life. So much of my day is spent thinking about the things that I should be doing and then being stressed about not doing. Right. So even if I'm quote unquote relaxing, I'm not really relaxing.
We're not relaxing. I know. So my dad is 78. It's going to be 79 in about a month. And he just finished working. He retired last year. And he, right now, is walking the Camino de Santiago.
That's right. With your brother?
Yeah, and that was my brother. So I went and walked with him for about a week. And then my brother just got back. And then my other brother's going next. And my sister and my mom are going at the end.
Oh, so all 4 kids and your mom.
Mm-hmm. But I'll share that for the time that I was there with him.
What is that?
Oh, sure. Yes. The Camino de Santiago is a walk, and the route he's on starts in southern France, but it walks across the northern part of Spain, and it ends in a town called the Santiago de Compostela. And it's a pilgrimage that's been done for thousands and thousands of years. And I think that there's some that believe that the bones of St. James are in that church. So a lot of people do it as a religious pilgrimage, but many do it for other reasons. It's just been done for so long, and there's a well-worn path. I mean, he's doing it for 35 days, and each day he walks between 14 and 20 miles.
Okay, yeah, that's a lot of miles.
It's a lot of miles. It's a lot of miles, and as you travel the path, you can stay in churches or hostels or bed and breakfast along the way. There's a lot of them to choose from. And
there are a lot of people doing it?
Yeah, there are. You meet people from all around the world. Not like, as you're walking down the path, it's not like you're surrounded in a big crowd, but there's...
When you get to a hostel, there's people there.
And you can see people ahead of you or behind you and who are walking. And so I went and did it I walked it for about 5 days. And man, you wake up in the morning, and you have a cup of coffee, and you put on your backpack, and then you walk. And it was at a time of day when my kids were sleeping, because Spain's 10 hours ahead. It's not like I could check my phone and see how they're doing, which is the one thing that that's my cortisol is building. It was so clarifying, and it did remove that cortisol, because you're just walking, and I didn't check on the news that often, hardly at all. You took pictures. You focused on walking. You just tried to be present in that moment. And it was so good. I wish you could go do that. As soon as the election.
I was just thinking about how I
you should.
It was something like that.
Yeah, where you just you turn off and you're just doing that.
And you know what? I want to do it for my son too. He's so addicted.
What kid isn't?
He wants to be on his Switch the moment he gets up in the morning. Right. It's a constant battle.
I know. It's a thing. My kids too. It's real. It's around them all the time. And it's just where because your whole day's planned. It's not like you have extra time. You're walking the whole day. It's a full day. And then when you get there, you're tired. Yeah, you're tired. You got to probably have to wash your shirt out or something. Right. You have some business you got to get done. You got to eat and you got to sleep.
Right.
Yeah, but you don't, it doesn't feel, turning off like that and just focusing on something was really wonderful. I wish everybody could have that.
I wanted to ask you that experience you had when you left South Africa all of a sudden and came back to Alaska and didn't have health insurance and got Denali Kid Care because you were pregnant, about to have a baby, had a 1.5-year-old. Now working at a clinic that accepts people who can't pay, that accepts people who have Medicaid, Medicare. Does that inform you as the director, having had that experience?
Yes. Because I want to live in a community where I know that a person that had my experience could get health care and could get access to the services they need for themselves and their kids. So sometimes when I'm having a hard day at work, what I like to do is just go sit, take off my badge, and go sit in the waiting room with everybody and just be reminded of, because sometimes you go to the doctor on any old day, but a lot of times people who are coming to see their medical provider, they're having a bad day right? I used to do that at Catholic Social Services too, and folks who are coming there, that's their worst day. They're having their worst day when they come to see you. So I just want to be there for people when they're having their worst day. I love working at Anchorage Neighborhood Health Center because we can give people the highest quality, the best healthcare with the best team, even though they might not have anything else in the world. Yeah. It's really important to me.
What would you say is the biggest impediment to achieving your goal at Anchorage Neighborhood Health?
I think that the biggest challenge that we face is, in some ways, it's the sort of our own systems and beliefs that keep us from searching out healthcare, or that keep people from opening those doors, because those doors are open to them. But I don't know if people feel like that they know that and it's theirs. And then I think the other piece is just that what we were talking about before, that competition, that issue of that healthcare and social services, those are not a business. It is something that is a basic human right and need that people have. And it's really hard to try to fit that kind of work into a system of business. And I think that underlies so many of the problems.
That's so interesting. That is not the answer I expected at all.
What did you think?
I would say, well, we never have enough money. As a legislator, I feel like everyone meets with you because they need more money.
Yeah.
And usually it's several $1 million or 50 million or, that's some number.
Yeah.
And then you hear about organizations like yours where it's like, I want to give you whatever you need.
Well, thank you.
And then,
That's very nice.
and then the answer is like, I just wish more people knew we were there and took advantage of us.
I do. I wish there were and that doesn't mean that, I think that it's not just that we need more money. More money could help us grow, but we should be able to also get this money ourselves by demonstrating what we can do. There's other things that I think have to come first. Yeah. And people coming in the doors, that's what I want the most. Then we'll find the money if we need it. I'll come and find you.
If folks want to learn more about Anchorage Neighborhood Health, how do we find you?
A couple different ways. You can go to our website, ANHC.org. You can give us a call. You can come by. You can always come by and you can make an appointment.
You're on C Street?
We're on International and C Street. Sort of, there's a Hyatt House there on the corner. We're right between that or by Trillista in there. Mm-hmm. And any of those will work, but give us a call. We'll help you make an appointment. We're also a great resource if you're just trying to figure things out. So you give us a call for all kinds of reasons. Come check us out. Come make yourself a health appointment. Make yourself an appointment with a primary care provider. You can get on the list for dental care. You can come and try to make an appointment with that.
Time for dental care.
It's longer. Right now, it's longer.
Longer than 2 or 3 weeks.
Longer than 2 or 3 weeks. It's hard. Bouncing back from COVID and dental has taken longer in terms of staffing. It's been interesting.
And I guess I asked about your capacity to see more patients.
Yeah.
Do you have staffing needs?
Great. Yeah, I think we do. We are pretty well staffed in terms of medical providers and behavioral health. And I just want to mention that again, because I know it's not easy to get in for behavioral health care everywhere in town. But if you are a patient of Anchorage Neighborhood Health Center, if you are one of our medical patients, you can get access to behavioral health care. So please, remember that and working with us. But I think in terms of staffing needs, dental assistants, medical assistants, and then dental providers like dentists and hygienists are still looking for that. And we have other positions, and I hope people who are looking will look at our website. I think we have an amazing place to work.
Lisa Aquino, thank you so much for being on the show today.
Thank you.
Visit Anchorage Neighborhood Health Center's website at anhc.org or call them at 907-743-7200. Or, as our guest today suggested, drop in person. Their address is 4951 Business Park Boulevard in Anchorage. Thank you, listeners. If you like what you heard, please subscribe, rate, and review us. To contact me, email rep.andrew.gray@akleg.gov or call my office at 907-269-0123.